This session is sponsored by Weber Shandwick.
Amy is the CEO of iReminder, and based in New Jersey. Amy is a serial entrepreneur. I understand that she recognized the opportunities that were on the internet very early on and developed one of the first applications that enabled online surveys. Please, Amy, tell us about what you do at iReminder and why is patient compliance an important topic to be talking about now?
I think it's been an important topic for a long time, but I think that people are now just more focused on it than it was. Because when I started my company about 4 years ago, I could tell that adherence would be the next big thing in the medical world. And so we developed a medical messaging company. We send out not only reminders, but we also send out educational messages and regimen instructions. And yesterday we heard about triggers, and one of the definitions of triggers was getting people to do what they want to do. And that's kind of where we are. We're talking about busy, active people who have a chronic condition, and they remember to take their meds in the morning, and they remember late at night, but during the day they're busy, they don't know where they're going to be. And we wanted to try to integrate adherence into their lives in a more natural way. So they can give us up to 3 places where they can be reached. It might be, phone, email, text, and we start at their highest priority. We try a couple times. They get to say how many times at each location, what the interval should be between times, and then if we don't get them at that first location, we continue to the next location. We also have a social component to it, which is that patients can identify backup healthcare partners. These could be family members, caregivers, and case managers, people who will help them keep compliant and also will encourage healthy behaviors. And the system will notify those people automatically if the person said they didn't take their medication, or if we couldn't find the person despite trying all these different places. It's very personalized. The messages can be as specific or as general as is desired. And we have a very easy built-in way for recording messages. So a family member, a daughter might record messages for her mother, a doctor might record messages for patients. They don't need any special equipment. It's all built into the system, and they basically just have to talk on the phone. So that's what we're about.
Thank you, Amy.